The governor's proposal to raise the cigarette tax was met with lukewarm applause during his State of the State address. Barb Lewis has more now in the business of health. Barb?
Gary, thanks. The proposal is to raise the tax on a pack of cigarettes from its current 55.5 cents a pack to just over 80 cents. Since Indiana is second in the nation for the highest amount of smokers, that means a potential for more than $100 million a year in tax revenue. And one state study says an estimated $2.4 million a year is lost to low productivity because of the health problems among Hoosier smokers. Joining me now is Karla Sneegas. She's Executive Director of the Indiana Tobacco Prevention and Cessation Agency, and welcome.
Thank you.
Let's talk a little bit about the amount of the tax increase. The governor has said at least 25%?
Yes, in November when the governor released his proposed health care plan, he suggested at least 25 cents. But in the State of the State, he suggested to the General Assembly that the higher we go, the more impact we can have.
Well, he didn't get a terrific reception. How confident are you that this bill will even find a sponsor? It doesn't have one yet.
Well, this, you know, anytime you use the word tax, it's a lukewarm response. But I think what we have to think about is that what this does is it raises the price of cigarettes, and it helps to outprice people from starting to smoke with youth, and it helps to outprice adults from continuing to smoke. So the tax is just a method for raising the price so that we can have an impact on smokers.
Now, in 2003, state lawmakers slashed your agency's budget from $35 million to $11 million. How confident are you again that you'll get the support that you need for some sort of passage?
Well, I think that, you know, as we move through the session, we're going to see increased support. There are a lot of Hoosiers out there that do support this, and I think that they will be communicating with their legislators about, you know, why they support it and why it makes sense for Indiana. We've got to do something about our high smoking rate. It's hurting us.
And Karla, what impact would this have on the business community? Why should the business community get behind this?
Well, we spend more than $2 billion a year in health care costs, and businesses look at that. They're losing money because of Indiana's high smoking rate. The more that we can improve the health of Hoosiers, and if we don't tackle tobacco use, we are not going to drastically improve the health of Hoosiers. The more that we can do that, the better it's going to be for businesses and the more attractive it's going to be for businesses. Currently, we've got the lowest cigarette tax rate in the Midwest. So when businesses decide to look at Indiana, they're also looking at, you know, Ohio and Michigan and Illinois, and they're doing a lot to make sure that they are discouraging smoking and that they're building a healthier population. We need to do the same thing.
All right, Karla, thank you so much for coming in.
You're welcome.
Well, if you'd like to know more about the cigarette tax hike proposal, just visit our website, InsideIndianaBusiness.com, and click on the Business of Health page. Also coming up this weekend on the public radio program Sound Medicine, the challenge of finding enough doctors to work in small Indiana towns. Plus, if you think it's too cold to exercise, listen to how a group of Alaskans are working out this winter. For more on that, just go to soundmedicine.iu.edu. Gary.